Morning, everybody. Welcome to the Etsimo webinar. We're just going to introduce you to the team before we make a proper start. So just introduction to myself. So I'm Simon Pickup. I'm the co-host, and I'm also the Vice President of Sales at Etsimo. And my partner in crime is CEO and founder. Thomas, over to you.
Thank you very much. Yes, so Simon already politely gave you my name, Thomas Grandel. I'm the first one of the Etsimo team. With me, we have a rock-hard team of PhDs in machine learning and artificial intelligence, and we work with the largest healthcare providers and insurance companies in the Nordics, but more about that during the program. So back to you, Simon.
Okay, so we're going to run a tight program where I'm going to ask you to write your questions down in the Q&A section within the Zoom webinar, which for the uninitiated, at the bottom on the right-hand side, you'll see the Q&A. If you type those in, and then we will answer those questions as we go through the agenda. So the agenda starts with quick introduction to who Etsimo are. Then we're going to talk about one of our large programs that we have on at Terveystalo, which is a chatbot case study, and it's the largest healthcare service company in the Nordics. The clinic's in over 60 cities. Then we'll take initial questions. Then we'll talk about our new venture in Brazil, which is the second largest state in Brazil, Minas Gerais, and they are running a mobile app version specifically for COVID-19, which is a huge problem in Brazil, which we're probably all aware of. And then take some more question and answers about that case study. And then on to our ProApp call center demo. And we'll also take some final Q&A at the end. So at that point, I'm going to hand you back over to Thomas, who's going to tell you all about Etsimo.
Yes, thank you, Simon. Etsimo is a platform solution for delivering what we call data-driven remote care to the masses through our customers. And as I mentioned, our customers are healthcare providers, insurance companies, and national health systems. And we do this by utilizing healthcare data and lifestyle data underneath machine learning and artificial intelligence capabilities controlled through an API. More about that later, but that specific technical solution enables us to accommodate a lot of different customer use cases and also a lot of different user interfaces. And just to make sure I'm not stepping on anyone's toes, our point here is definitely not to make doctors obsolete, but instead to help doctors with the help of machines, determine the care need of individuals or consumers or patients, so that they can get a personalized care assessment and a personalized care path, which we call customer-centric healthcare. The problems, as you are probably aware of, is that healthcare is expensive. We spend a big amount of money on healthcare, and still there is a lot of errors happening because humans make errors. And also in some parts of the world, healthcare is limited either due to monetary reasons or logistical reasons. Also, most of us know that we could take better care of ourselves, and it's 8.5 times more expensive to treat sickness than it is preventing it. So with a little help from machines, we could do a lot of good also in the preventive and predictive space. We could tell you based on your data what risks you have in the immediate and midterm future, and we could try to help you change your evil ways, if you may, so that those risks would either go away or be reduced significantly. And also due to the fact that humans block the adoption of, or humans make errors they kind of block the adoption of digital healthcare. So if we have too many humans in the loop, we won't get the kind of data that is needed for machines to operate on. So it's best to have the whole process digitalized, and that gives us the possibility to shift the focus from the current treating sickness focus to the focus of keeping people healthy, which should provide a win-win situation, or actually a win-win-win situation between the consumers, the providers, and the payers. Currently, there are 3 different technologies that are converging to transform mobile health and telehealth. The first one is artificial intelligence, that we strongly represent. The other one is always on health monitoring, which means the data that wearables and IoT devices, sensors gather about humans all the time. So if we can use that data for the humans to use in their day-to-day health monitoring, that would be a great step forward. And the third one is the cheap diagnostic devices that are emerging on the markets. For example, a stethoscope that you can connect to your mobile phone, and through that stethoscope you can send your heartbeat signals or sounds to a physician that is treating you over a video link, for example. And originally it was thought, or actually in the beginning of this year, it was thought that the mobile health tipping point would come in 2 to 5 years. But due to COVID-19, the tipping point is right in front of our feet at the moment. And what we do is we sort the patient stream to optimal care. Currently, everyone who thinks they need care is trying to get through the same door at the same time. And in certain situations, for example, when there is a pandemic going on, this is not a thing that is desirable. The healthcare system is easily overrun. So we sort the patients so that the right patient gets the right care at the right time, and also, of course, with the right information, which then enables us to start with the right treatment and to make sure that recovery goes as quickly and painlessly as possible. So this stick figure here is a consumer wondering if he or she should see the doctor, and this mirrors the solution that we have in place at Terveystalo. Our solution is integrated into their own mobile app called freely translated My Health. And when you are trying to set an appointment, the application asks you if you want to do a care need assessment. And if you answer yes, you will enter your symptoms and some specifications of your symptoms. And some of the data about you we will take from the electronic health records. And based on that data, when our algorithms are finished, we can very accurately tell you what your condition is, what's the care need and urgency of that condition, and what the next step should be. And the next steps can be split into 4 major pipelines or care paths, where the first is self-care. So if your condition doesn't require or wouldn't benefit from seeing a professional right now, we tell you what your condition is, then that you should stay home and take care of yourself. And if the symptoms get worse, circle back. The second one is something that we call asynchronous care. So that means that the data that we have collected about you is so self-explanatory or clear-cut that a doctor can do a diagnosis based on that data, and also, in if needed, write you a prescription and everything else needed, without you and the doctor being in an online communication setting at all. So this is an offline care pipeline, so to speak. The first online care pipeline is remote care. So again, the data, the pre-information or anamnesis that we have collected is pushed to a remote care channel, normally chat or video, and a human takes over the case and writes the diagnosis and everything else needed. And the fourth one is the face-to-face consultation, the most traditional current way of getting medical attention. But here too, if the data shows that the condition that you have would require a blood test, and the data shows that normally when you see a GP, he or she will send you to a blood test and then ask you to come back for going through that blood test or the results. We can instead send you directly to a blood test and after that to a doctor, so that the doctor has more information at hand when the patient comes through the door. Another example, if you have twisted your knee, maybe a GP isn't the optimal, let's say, doctor's competence for evaluating that injury. Maybe you should see an orthopedist. So based on the condition and the diagnosis that we have made, we can send you directly to the orthopedist and skip a few steps. And from all these cases, we get a diagnosis. And based on that diagnosis, we can follow up on your recovery. So we can send you a message to make sure that, for example, the antibiotics are working if you got that through a prescription from a doctor. And please remember this step, because from here on, I will call this case monitoring, and I will circle back to this topic in a little while. And the end result is that the patient has recovered, and we hope this process to be as smooth and uncomplicated as possible. And our engine is the core of our offering. It lives in the cloud. It's completely data-driven, and by being data-driven, we mean that we can expand the capabilities of the engine with more data and more cases. So from that point of view, it's future-proof. It's not static, and it's fully controlled through an API. So based on that, it fits to any solution that you might think of, as long as it conforms to our medical device operating rules and our interface guidelines. But as I said, you can have almost any use case and almost any kind of user interface, either an existing one or a new one made for this purpose. The current version has support for over 750 physical and mental conditions, and these are grouped into 102 separate diagnosis groups. It also includes red flag symptoms that make sure that if the patient has an emergency or urgent condition, we tell them to stop playing around with the application and call the emergency hotline instead. Our solution is not as such certified for emergency care use, but sometimes people are not very smart, so they can still use the application, and if we detect a serious condition, we will tell them to call the emergency hotline. Also, we have something called quick start templates, which are completely configurable to the user and or the use case and the customer, and they are quick starting points for patient suspicions or professional suspicions. So if I think I have the COVID-19, I would start the COVID-19 quick start, and I would get the exact right questions, which means that we can go through the case quickly and conveniently. It can also be integrated into existing solutions, or it can be run as a complete standalone version without any integrations. And the user can be either identified so that the system knows who the user is, or it can be run as a completely anonymous case. And you can integrate it both upstream and downstream to existing systems, such as appointment settings and EHR systems. It's fully configurable also in terms of what it does and how it handles results and what it shows to the end user. So for example, in the public sector in the Nordics, the customers that we have, they don't want the end user, the consumer, to see the result of the care need assessment in case it's not suitable for self-care. they think that it will worry the patient more if they know what they have. I might not agree with that in all cases, but it's possible also to show the cases as long as they are not, let's say, too worrisome. So if the data shows that you would have, for example, cancer or something similar, very unpleasant, we would tell the patient that based on the symptoms you have given, we recommend that you set an appointment to a doctor to do further tests. So in that way, we don't worry the patient more, which is important. Also, in terms of risk handling, it's fully configurable, or let's say configurable to a point. So for example, you can never put an emergency stop to self-care. So if you have a heart attack, it will always tell you to call the emergency hotline. But in other cases, for example, if you have a patient with a history of migraine, and the system shows a migraine probability of say 95%, but still there is a small suspicion, let's say 0.5%, that the user might have a brain hemorrhage or a stroke. What do our customer want the system to do in those cases? And the options are, for example, that we trust the probability of the migraine diagnosis and we tell the patient to take their medicine and stay home and recover. Or do we want to take them in for a checkup just to be safe? So all of this is configurable. Also, based on our way of building the system, it's easy and quick to adapt to new markets, new regions, or new vendors. And there is more or less two things that needs to be done. If the region or market is far away from Europe or the Nordics, we might need to adjust the diagnosis prevalence to reflect the situation in that region, and also make sure that we have all the needed diagnosis supported. And the second thing that you need to do is to make sure that the target languages of that region are supported. We are doing this for real. So we are a medical device within the EU and also in Brazil. And when we have added a few more features that I will tell you about in a while, we will upgrade the whole system to a MDR Class 2A medical device classification by the end of this year. And when we started building this, GDPR was already on the horizon. So the whole system is built to be GDPR compliant by design. It also implements the My Data philosophy, which means that the data the user, the consumer enters, belongs to the user. And all data is fully encrypted, so the data is safe with us. And we can't access it without the consent of the user. From a high level, the architecture contains of a cloud solution currently in Microsoft Azure, and the components of the system is different kinds of data. So data about the customer, this could be IoT data, EHR data, and other things. Then we have the diagnosing data that is actually the basis for the care need assessment. And then for all kinds of use, we generate logs, which are usage data. And the system is self-learning, so combining these data sources all the time improves accuracy and makes it possible to run new features through the system when sufficient data is available. The data is operated on by our Etsimo Diagnosis Engine, or EDE, and controlled to an API, through an API, which means, as I said, that you can integrate into your existing applications or build a completely new one, and it confirms to your service design standards and your user experience targets. And the users, the end users, can be identified or not, and it can be integrated easily into existing systems and legacy systems. Terveystalo. In Finland, we have two major partners. One is Terveystalo, which is the largest healthcare services company in the Nordics. The other one is called If, and is the largest health and life insurer in the Nordics. But the case that I'm going to show you is from Terveystalo. So Terveystalo has around 20%, a little bit more than 20% market share in Finland with 1.2 million customers, over 10,000 doctors and nurses, and 5.4 million visits in total per year. And they have been our strategic partner and investor since November, December 2018. We have done several things with them, but the two major achievements are a ProApp, patient care need assessment tool for professionals. I'm going to show you that one a little bit later. And also a chatbot self-service care need assessment that has been integrated into the mobile app of Terveystalo. And what they are looking for by using telemedicine is to control demand by utilizing friendly gatekeeping. And friendly gatekeeping means that we ensure that the user gets peace of mind by getting knowledge about their condition if they don't need medical attention. So we tell them you don't need to see a doctor because, and then the reason, instead of saying that, sorry, you can't see a doctor right now. Also, the main theme for all our clients is that they want their patients to get the right care at the right time with the right information, because this makes it possible to do resource and process optimization based on utilization and data. And it also leads to consistent quality at scale. So next I'm going to show you a quick demo of the chat version that we have implemented in Terveystalo's mobile application. And don't mind the web page behind it. This is just to show a standard web page that can look any way you want it to look. And we put some boring text here in the background just to make it not be completely blank. But anyway, the chat experience starts by you giving your consent to the term of use and the privacy policy. And after that, if we are in an environment where we want to enable the patient to select what language they want to use, you can do that. So let's use English for this one. And then if we are not integrated into the EHR system and we haven't identified the patients, then we have to ask them their gender and also their age. If this is integrated into an existing system, we wouldn't need to do that. It would know based on who has logged into the system. And what I'm going to show you is a case of something called norovirus, which is a stomach bug and a fairly nasty one. So these are quick starts that has been built to specification for Terveystalo. So what that means in practice is that these represent the, let's say, the main volume of patient cases coming in to Terveystalo's digital channels. And for the demonstration now, we're going to use diarrhea and vomiting. So after you selected the main, let's say, direction of the case, it starts to ask you first some questions that either strengthen a current prediction or remove some doubt in certain cases. So if I have diarrhea or vomiting, it would be fairly safe to assume that I have vomited, which my boy actually did, and he was feeling nauseous too. And muscle pain was something that he didn't have. He did have a fever, and unfortunately a diarrhea too. Poor appetite, sure. Abdominal pain, yes. But he hadn't traveled outside Finland, which eliminates a lot of the interesting tropical stomach bugs out there. So we're going to answer no to that. And when we get the almost there statement, that means that we have closed down on the correct sector. And now we are doing a mix of triage and care path related questions to determine the care need and the urgency of the case and the patient. So has the diarrhea lasted for a long time? No, it started today. Pain, especially in my upper abdomen. I would say no to that as well. Is my body tender to the touch? No. Do I have a headache? I don't think so. My heart rate feels normal too, or it felt for him. Fortunately, no problems with urination either. No cough. And no muscle spasm. Muscle spasms relate to dehydration, and if you have had the stomach bug for such a long time that you are dehydrated, this is a bad thing. But this started just a minute ago, so nothing of that. So now we know, based on the symptoms, that you have a disease of the digestive tract. So this is the larger group. So yes, you have a stomach bug. And also a smaller group within this group is the acute diarrhea, which contains 4 different diagnoses, and one of them is norovirus. So this worked out just as it should. So what are we doing in Brazil then? Well, we have 2 clients. We have the Minas Gerais state with over 20 million inhabitants that we have already rolled out the production version for, mainly to differentiate between COVID-19 and other care needs. And then we also have the Santa Casa hospital chain with over 2,000 hospitals, not confirmed in the Minas Gerais state, but all over the country. And the main problem here is that, first of all, the health system was overrun. And secondly, there isn't enough telehealth providers, as telehealth became legal in the beginning of the year at the time of the COVID. So the amount of telehealth providers is fairly limited. So we want to make sure that those who have a COVID-19 suspicion is routed to telehealth, and the other ones will get traditional healthcare and traditional appointments. And here, if any place, the demand control is of very big importance. So we want people to get care regardless of their symptoms, but we want to split the care stream between those with a COVID suspicion and the other ones, so that we make sure that the COVID infected people don't infect anyone else. And the second one is the familiar right care at the right time with the right information. And the third one is maybe new also, which is to increase the reach and the service level of the hospitals. So if they are overrun and there are no humans that are able to take your call, you can get help from the machine. And that also means a new thing in Brazil, which is to adopt to the use of remote care. And I'm going to give you a COVID-19 demo in a little while, or our version of it. But before that, I want to point out that most of the current COVID-19 screeners or digital tests have been built in a hurry, and they work about like this. So the patient has some symptoms and is worried, do I have the bug? Am I infected? And they give in a few things about themselves, and more often than not is a vague suspicion of COVID-19 and a suggestion that the user contact the authorities, which he or she probably will do. And this doesn't work because the patient doesn't get any peace of mind. They still don't know anything more. They just maybe get even more worried as they are supposed to contact the authorities. And on this side, on the authorities side, we have the same situation as I described earlier, but maybe 10 times worse. So everyone is trying to get through the same door at the same time. Some have mild symptoms, some are maybe almost dying. So we need to fix this. And that's why our solution works a little bit or a lot better than the one that I just described. So here it's of utmost important that we know what you have, we know how severe it is, and we get you, if needed, to the right care and also at the right time, and we provide the right information for the care personnel to operate on. And if you don't need care, we monitor your case so that we are able to escalate it if needed. So the same person, worried, uses our solution through an existing app, for example, but instead of giving just symptoms and travel information, we also ask for symptom severity and your personal risk factors. Risk factors might be pre-existing conditions or age or lifestyle related, let's call them features today. So are you super fat or do you smoke? And based on this amount of information, we can give you a personalized care path. And that contains the condition, care need, urgency, and the next steps as is normal with our engine. But with this, we can sort those who don't have the COVID-19 suspicion into the traditional pipelines, and they will be taken care of by non-COVID clinics. But then if we have a COVID-19 suspicion, we can, in case you are a young and healthy person, we can ordinate self-care, self-quarantine, and case monitoring. So that would mean that you would, for example, daily check in and report about your symptoms. And if the situation is getting worse, then we can escalate the care towards, for example, a human check. So there is a human going through your data and making a decision. Or we can put you up to a remote care session, or we could send you to face-to-face care, including a COVID-19 test. Then again, if you are an elderly person with several chronic conditions, the right care path, even though your symptoms might be mild, would probably be to send you to a COVID test as soon as possible to confirm your case, or at least to be able to know if you have it or not, because the predicted care need of an elderly person is a lot more severe than for a young person. So we need to be able to sort the patients according to current conditions and the predicted future care need. And now over to the demo. And this is still an experimental version. An experimental version in this case means that there isn't enough clinical data available for us to do clinical trials and to get it into our clinically validated product. We estimate that this will happen during the summer, so this will be included in our regular clinically validated offering by end of August or early September this year. So let's put in, let's say, a female, age 35, for example. You have different quick starts to begin with, and we are now interested in coronavirus. The difference between the quick start is that we are able to differentiate the coronavirus from around 30 respiratory infections. So we're not only able to tell you if you do have the corona, we are also able to tell you that if you don't, what is it that you're suffering from. So first, let me give you an example how most of the existing ones work. So yes, I've been traveling in the coronavirus area, and immediately, because we have no other data, we have to assume that there is a 50-50 chance that you might have the virus. And if you have come in close contact with persons that have the virus, again, that ups the prediction. And this is the situation where most other coronavirus checkers would send you to care. But let me delete these and show you another thing about symptom severity. So if I would say that I have difficulties breathing with no other symptoms at the moment, that is regardless if you have the corona or not, it's a bad symptom. So you should go to the doctor immediately, or at least within the same day. But let me delete that one also and show you an example of a mild case. So let's say that I woke up this morning with a slight fever and a mild headache. So those are the only symptoms that I have. And based on these two, the machine has made a prediction that we have an upper respiratory tract infection, most probably. And it starts to generate questions about the condition that it suspects that I have, and it dynamically changes the questions to more appropriate ones as I give the machine more evidence by answering the questions. So do I feel tired? Yes, I do. Difficulties breathing, I have not. I have mild symptoms. No visible skin changes. No, nothing of that. Am I nauseous? No, not really. Do I have a cough? Well, maybe a little one. And have I had it for a long time? No, I have not. Is the cough strong? No, it's not. Do I have a runny nose? I do not. Enlarged lymph nodes? No. So now we come to the personal lifestyle related risk factors. So now the machine is confident enough that you have an upper respiratory tract infection. It can be corona, but it can also be something else. So there is a bunch of acute bronchitis, common cold, rhinitis, and so on. And the personal risk factors affect my care needs. So let's say that I do smoke daily, and notice here that it says home care instructions, and if the symptoms get worse, you need care within a week. And these can of course be configured also. So let's say I smoke daily. So here, if the symptoms get worse, I should immediately circle back to care. And let's say I'm not overly fat. I might have a chronic disease. Let's say I have diabetes. So that still keeps the care within the same day as the suggested care. So if my condition doesn't get better during the day, I should seek professional advice. Are my symptoms severe? No, they are mild. Do I feel that I can't cope at home? No, I'm fine. I can cope at home. So if I remove the daily smoking and the chronic condition, the care need will go back to care within a week. So now I'm 35, I'm healthy. I might have the corona, or I might have an upper respiratory tract infection, but there is no need for me to go see a doctor. And if I add that I've been traveling in the coronavirus area, for example, it suspects coronavirus, but as you can see, with mild symptoms, no pre-existing conditions, young age, it tells me that stay home, self-medicate for a week, and if the symptoms persist, maybe you should chat with a nurse or take a nurse appointment. So this is the basic functionality of our coronavirus version, and as I said, it will be available after the summer as soon as we get enough clinically validated test data to run clinic tests on the system and include it into our medical device. All right, Simon, back to you.
Thanks, Thomas. Thanks for taking us through that. I have a couple of questions. First question, can the platform also be used for predictive healthcare based on health and lifestyle data collected through wearables and devices?
Yes, when we have enough data, we can even predict the statistical lifespan of a patient based on research done in Finland. And we can also predict your short and mid-term risks, for example, within the next 3 to 10 years, to get some chronic disease or irreversible condition. And when we can predict, we can try to prevent it. So we can make the user aware of this risk and suggest personalized lifestyle changes to reduce or remove the risk altogether. So that's definitely on our roadmap. So with more data, we get more capabilities, and this becomes a flywheel where data generates insights, and the insights again generate more data, and the picture gets bigger and bigger.
Great. And then an add-on to that is also adding manual personal data to an app on a daily basis.
Yes, so that's the case monitoring part. Great. So that depends on how our customer wants it to work. So do you want to just confirm that you have the same symptoms, or do you have to kind of enter them from scratch every day? Both are possibilities, and of course that there can also be something between that, so that you get the results or the input from yesterday, and you just kind of change the things that has changed, if anything, and then you just confirm that this is how I feel today, and that creates a timeline that makes it possible for us to escalate or de-escalate your care.
Thank you, Thomas. Okay, that's the end of the questions. So carry on to the next demo, please.
All right. So the next and the last one is the ProApp, which is a tool for professionals. And the clients in our case are healthcare providers, insurance companies, and also call center service providers. And it's built for web browser usage. And it gives the professional the possibility of doing a care need assessment on the patient based on the patient's basic information, health history, current symptoms, and the characteristics of the current symptoms, for example, duration or pain level or amount or the degree of fever. And there are 2 user groups here. It can be used by, let's call them real professionals, which would be doctors and nurses, and also by laymen as call center operators or front desk staff that aren't certified nurses or doctors. And the aim here is to support the day-to-day work of the professionals, to make sure that they ask all the questions, answer all the requirements to be able to document the case properly, and again to make sure that the patient in question gets the right care at the right time with the right information. And in hectic situations, having a tool that kind of in a good way forces you to work consistently all the time also leads to consistent quality, both in terms of care placement and the documentation that is the result of the case. So over to the demo then. It looks like the COVID-19 version that I just showed you, because the COVID-19 version is going to be integrated into this one in a little while. But I'm going again to use my other boy as an example here. He came from his room one day and told me that he doesn't feel well and his foot is extremely red. And I was wondering what was wrong with him. So of course, I used Etsimo's system to determine the case and the care need. And he's 22, and he told me that he has a fever. So I can search for symptoms like this. And these are similar quick starts that were visible in the COVID-19 case. And it shows a number 1 here because I have entered 1 symptom, and here are the matches in the quick starts for that symptom. So if by listening to the patient, I determine that, all right, he probably has diarrhea or something, I can start picking things from the symptom group instead of continuing to search for them. But anyway, back to the case, my son had over 38.5 degrees of fever Celsius. So we're going to answer yes to that. And then on top of that, he said that he has been tired for a few days. So tiredness. And as you can see from the right side of the screen, fever and tiredness is a respiratory tract infection. It's either the common cold, or if the influenza season is on, it could also be influenza. And above the possible causes, you have the suggested care, and also the anamnesis is being built. But let's add a few more symptoms. So the most weird one was that he had severely red or severe redness on his left leg. Redness of the skin. There we go. He didn't have any significant pain, but he did have a skin rash, and that was definitely on the limbs. The skin hadn't experienced any changes, so it wasn't flaking or there wasn't fluids running out from it. So I'm going to answer no to that. And the fever, well, I'm not sure if it's long-term or not. It was a few days, so let's not answer that one. Swelling in some parts of my body. Yes, his ankle was extremely swollen. And ankle is on the limbs. And is the swelling severe? Yes, it was. And so on. But this version is relying on the user's estimation on when enough questions have been answered. So when we have a probability of over 95% for the possible cause, I think we can stop asking. So we are extremely sure that there is a skin disease problem due to the symptoms or because of the symptoms entered. And also we are almost as certain as that the condition is something called erysipelas, which is a bacteriological infection in the foot due to a laceration in the foot where the bacteria has gotten in. So based on this, we have the anamnesis built. Patient with no chronic diseases has symptoms, and then a list of symptoms, and the suggested care is a doctor's appointment. And by clicking on this button, the operator can transfer the information to the appointment setting systems and also to the EHR systems. So this is a very one screen or a very convenient way to use one screen to both document the symptoms, to answer the specific questions about the symptoms, to answer machine generated questions, and to see the results as they get built. And when it's done, the information is transferred down the process to the doctor or the nurse that takes over the case. So this was the ProApp, and I suspect it's time for maybe some questions.
Thank you, Thomas. We don't have any further questions at the moment.
All right.
So maybe we could go to the final wrap-up screen.
Yes.
Myself. So
indeed,
Etsimo. As I'm sure you'll hear, very passionate. We know it's the best and most comprehensive data available in the world. For those uninitiated, Finland has probably the highest regard to the health professionalism, but also the data. And our platform has 30 years worth of data collected from our partnership with Terveystalo. So we're very proud and assured that our data is as robust as can be when it comes to providing our solution. So it's built by the best dedicated AI and machine learning team in Northern Europe. So people that are dedicated to the cause, and we put together the best minds to progress this platform even further. So it's building an ethical and traceable and future-proof surface and capability. So what we mean by that is that we have a symptom checker, an incredible accuracy as we speak now. But as we link it to third-party provisions like EHR systems from around the world, we can also provide predicted disease validity modeling, and then also provide preventative healthcare triaging. So looking at people's makeup in terms of their parents, and also from any other comorbidities that they might have, we can start triaging to other services that might be available. I mentioned about our strategic partnership in the Nordics. It is the largest private healthcare provider in that area, and that helps us to further develop, validate, and pilot in production all the services that we have available. It's obviously a solution built for data-driven healthcare, so it's all outcome-based. So as Thomas mentioned around our COVID, even though we're having our production mobile app of for COVID in Brazil, that's going to be integrated into our main service and will be CE marked a little bit later this year. It's providing a highly accurate need assessment and automation of care placement. So it's very accurate, though it's obviously not an exact diagnosis, but most of our diagnosis goes into the 80–90%, as long as obviously the patient is putting in the right symptoms that they're having. Most importantly, especially with news that has been circulated of recent, sadly with some data leaks, trust is one of our core values. In fact, every member of our staff have to go through a legal and regulatory training to make sure they are ISO and GDPR knowledge and compliant, and obviously our patient safety and data records are of our utmost care and attention. And then finally, the platform is component-based and accommodates all uses and user interfaces. So we can simply provide you with the technology, and it can be linked to your own systems to provide, hopefully, a complete solution. And that's all from the Etsimo team. If you'd like a specific demo, please don't hesitate to click on one of the links from original homepage, or send either Thomas or myself an email, and we'll be happy to set up a demo and take you through any of the questions that you might have. And that was all. So from on behalf of myself, thank you very much for listening, and final words from Thomas.
Yes, thank you all for participating, and I hope you know a lot more about Etsimo and what we do. So with these words, thank you for participating, and have a great rest of the day.